Hello, viewers. You are welcome to the studio today. My name is Veronica from the Kamp, your host as usual. And today we are going to talk about long COVID. But before then, I'll allow my panel to introduce themselves to you. My panel, I have Amsterdam UMC, Ganzenhoef GP practice, and also the C support. Stay tuned. Can you please let my viewers know who you are?
Of course. I'm Brent Appelman, so I'm a doctor at Amsterdam UMC, infectious diseases, and I study long COVID.
Yeah. My clinic at huisarts Ganzenhoef, and I've been a doctor in Southeast for the past 10 years.
Yeah. Thanks for coming. And our own.
Thank you very much. It's good to see you all again. I'm Charles Ajman, professor in Amsterdam UMC. I do a lot of work on migration and how it impacts on health. So it's truly a pleasure to be with colleagues, and then also more importantly to meet you again to discuss this very, very important topic for the community.
Yes, it is very important, and I'm happy that despite your busy schedule, you've made it possible to sit with me today. I think I'll go straight to Dr. Adi. Doc, that COVID still exists because we hear a lot of people have the coronavirus now. And should we be worried about it? Is it still dangerous?
That's a very good question. I have a lot of patients who come to the clinic and say, but it can't be COVID. I'm having symptoms, flu-like, coughing, pain in their muscles, but it can't be COVID because that doesn't exist. Right, Doc? No, it does still exist. COVID is still very real. The coronavirus is here, and it is actually probably here to stay. So we have to have the right information so we know how to deal with it. But your question, very important, does the COVID virus still exist? Absolutely. Should we be worried or afraid? I think we should especially know what the symptoms are and how we can stay healthy so we can fight it when we do get the COVID virus.
Let's come to the vaccine. Is it still ongoing? Is it necessary to get the vaccination, or now it's no more needed?
I'm very happy that we still have the vaccine. At the moment, we don't vaccinate everybody like we did a couple of years ago. There are certain groups who do still need to be vaccinated so that their body can fight the COVID virus better than if they don't have the vaccine. So, for example, if you're pregnant or if you have an illness that makes your immune system not work as well, then you could get very sick from the COVID virus. And for those people, they can still get the vaccine. There's a special phone number, actually, that they can call to make an appointment. That is 0800 7070. They can get the vaccine. For the people who aren't pregnant, they do need a referral from a doctor. That is important to know, but then they can make an appointment. For the other people at the moment, they don't have to get a vaccination, although the government will see if when the weather gets bad at the end of the year again, when you have the normal flu shot, if it's going to change. So it's important to keep up to date with the right information.
Okay, so people who get the grape prick, as we know, every year, these people have to get the vaccination.
That information will be known at the end of the year. For now, the people who can get the vaccination are people who are very sick, but they get the information from their doctor normally, or women who are pregnant. Those are the people that can now get the vaccination. Okay. And if you're not sure if you should get the information, you can always contact your doctor, because then you can talk about, is it for me? Should I get it? If you have any questions. So if you're not sure, you can always ask your doctor.
So you don't get the letter, you can just ask your doctor if you really need it.
If you need it, yes.
Okay. So as a GP, what advice do you have for people watching us at the moment when it comes to the coronavirus?
Well, what's very important to know that if you have symptoms like coughing, sneezing, muscle-like, flu-like symptoms, it could still be the COVID virus. Okay. Luckily for a lot of people, you feel a bit sick, but it's not dangerous. But it's very important for some people to know, if you do get sick, just like with other diseases, contact your doctor. And in some cases, the doctor could still ask you or tell you that it could be the COVID virus. We don't always have to test anymore, but when your doctor asks you, I do want to know if it's the COVID virus, the doctor could still ask you to check.
Okay. Thank you very much. Let me go to Dr. Brent. Corona test locations cannot be found anymore.
No, they're not here anymore.
Does it still exist?
No, so the locations are all gone. So we do have the self-test, so the rapid test that you do by yourself. But we do not test on a large scale anymore. No, that's all gone.
So it means we only depend on the self-test.
On the self-test.
It seems to be very expensive for the people in the community.
Yeah, I can understand that. It makes it a little bit difficult. But like explained, it's best to watch out for the symptoms that you have. So if you're sick, then you stay home. If you have ill, you're feverish, then you stay home to protect yourself, but also protect the others.
We've been hearing about long COVID, something we don't know much about. No. A few who have heard about it have a wrong understanding about it. Because COVID really affects your lungs, so that is long COVID.
Long COVID.
Yes.
Confusing name, I know, yes.
Yeah, and with others, when you have the COVID and it takes too long, I mean, you are tested positive and it takes too long to be tested negative, then that's called long COVID.
Well,
so
not per se the test. No,
that's what
it's confusing, I know, right?
It's confusing.
Okay, need to clear this up.
So
it's super clear.
What is it?
So what we're talking about, if we're talking about long COVID, it means that you still have symptoms 3 months after the infection, after the COVID infection. So 3 months after that, you still have all the symptoms, that you're super tired, your brain is not working fine, you cannot focus really good, you have pain in the muscles. And that symptoms must be there for at least 2 months. That's the official criteria. So it actually means that you still have symptoms after the initial infection that do not go away. You don't have to test positive, like fatigue, that you're very tired. People often don't work anymore. Also brain problems, that you cannot focus really good, pain in the muscles. There's a lot of symptoms actually. We don't know actually how we can detect long COVID. That makes it really, really difficult. So we do not have a test like with the COVID virus.
So how can you know you have long COVID?
Yeah, that's an excellent question you ask here. What we do as doctors is we examine you and look for if there are any other problems. And we exclude those problems. So we exclude everything else. And then finally we get to the diagnosis, long COVID. But we do not know how to test it. There's no test we can do. Not yet, at least.
So there's no test to confirm that you have long COVID?
No. So the doctor really does it by a diagnosis. You really should visit your doctor when you have symptoms after your corona infection.
Prof, you've been doing some work on the ethnic differences on long COVID. Are there differences at all between the ethnic groups in your study? And what do you know about our community in Amsterdam?
Yeah, thank you very much. I think this is a very, very important part. And that's also a pick on from what Dr. Brent has just said, right? So the long COVID is certainly is a big issue, right? And you've just basically mentioned that actually when you get it, the symptoms and the symptoms, you just have to be confirmed by the doctor, right? So many people, even though they do have the symptoms, they don't know they do have, because the symptoms tend to be also similar with other conditions. And that is where actually the problem is. But within the community, within the different population, I mean, our own work, which Dr. Brent was part of, we did some study in Amsterdam. And within that study, what we actually found that if you compare it to the Dutch population, the rate of, or if I put it very simply, the minority populations tend to develop more COVID compared to the Dutch population. That is the work we find it in Amsterdam. Okay. There is also some studies coming out in Denmark, which is also was part of. There too, we found that actually, if you compare it to the white Danish population, the minorities again there also tend to have more COVID. Of course, in our community, specifically, unfortunately, the data that we have was not large enough. So we really don't know exactly whether, for instance, the African community in Amsterdam tend to develop more long COVID or not. That we don't know. But I think that, the history that the COVID has taught us, for me, if indeed the other minority groups are having more issues, it is very, very likely that the problem will also be in our communities, right? Because the reason why I'm saying that is that if you look at the predictors, or if you put it simply, the determinants, the factors that actually we saw which contribute to that, we saw that those people that were more likely to be admitted to hospitals tend to develop the COVID more, right? And if you look at the previous studies that we did, we know that if you compare all the minority population in Amsterdam or in the Netherlands to the host Dutch population, the minorities tend to develop the COVID more often. They tend to have more complications, and they tend to be admitted to the hospital more often.
Why do you think this so?
Well, I think that also has to do with the issue that previously you talked about, because you remember that the minority populations, they usually tend to get more exposure. In other words, many of them, the work that they do, right?
Parties
or so. Even that, because, many people tend to get a multiple exposure, especially if people are working, unfortunately, many of our communities, people do jobs like, cleaning jobs and restaurants and other. There you get to meet so many different people coming in, and that makes you a bit more exposed. So that also means that your risk of having more complications become higher, and that is why many of us is actually during the COVID period, many people were exposed. So although you don't have the data, but all the indications are that it might be higher among our group, but we need to basically do more work to really confirm it. So that is what we actually know about this at the moment.
Okay.
And I think it's very important to add that not everybody that gets COVID gets long COVID.
Exactly.
Those are two different things. So you can get COVID and be completely healed, but a part of the people that get COVID, they stay sick. They keep on having symptoms for a long time, so long after they have the initial COVID infection. And that group does have it for a long time, and we need to do more research about that, because it's logical that if more of our people, our community, minorities get COVID, if the group is larger, then also the group that will have long COVID is also larger, because there was more people to start with. Everybody can get COVID. It depends on whether you get the virus from somebody else. What we are doing now in the sense of trying to protect people, because we do know that people who are weaker do get more complications when they have COVID, and possibly also to develop long COVID, but more has to be researched about that. But to protect people from getting very sick from the start, that's where the vaccinations are important. So if you have a weak health, very weak health, and that is determined with you and your doctor, then you can go get the vaccination. And also pregnant women are eligible to get the vaccination. So they don't, if they get sick, don't get very sick, have to get admitted, or even worse.
Dr. Brent, what's your advice to my viewers about long COVID?
First of all,
And the vaccine.
yeah.
And everything.
No, everything. It's a difficult subject, and you very well explained that there are two groups. One that's already a little bit ill and can have a severe COVID infection, and the other group that gets long COVID. And they have long symptoms for years and years. I have patients, they cannot work anymore, they cannot function anymore. For them, we must find a solution, of course. For the first group, we have vaccinations. And for the second group, we don't know, because we don't know what's happening. So we have to do a lot of research. Most important is that if you're not feeling well, go visit your doctor.
Okay.
He should look at you, he should examine you, and maybe there's something else that we could help.
And especially if it's longer, because
if it's
of
longer,
course,
yeah, 2
everybody,
days, no problem.
everybody can get a bit of fever,
Of
a bit of a runny
yes.
nose, a bit of cough. So it's not necessary that everybody with the smallest symptoms goes, but especially if it takes long, because otherwise the doctors will get a bit
if
too
it takes
busy.
months,
If it
then you
takes
should
months.
visit your doctor, because then we should have a look if something else is going on.
Yes.
For those people, we do not have a solution yet, but we're working on it, and we're really trying really hard.
We don't have a cure, but there are things
Supports.
that can be done.
Yes.
Okay.
But we will hear also from that from C support. So even though there's not a cure yet, it is important to go visit a doctor if you are not able to function like you did before. It could be long COVID, and then there are possibilities to get support with that. That's very important to know.
Good. You've mentioned about C support. Well, viewers, is there help for long COVID? Stay tuned. Be right back. We are going to talk to C support, what they have in stock for you. See you. Welcome back, viewers. Joining us at the studio is the C support. Is there help for long COVID? We are yet to know. Stay tuned. And Professor, I think before I ask C support to introduce themselves, I would like to know what's the impact of long COVID on social and economic circumstances, especially on communities such as ours in Amsterdam Southoost.
Yeah, I think this is very, very important question, actually. I mean, the problem with the long COVID, as we've been discussing, is that, usually when people do have this, especially in many communities, people don't even know they do have it, right? And if people do know that they don't have it, or they have a lot of issues with the symptoms, they don't seek help, and that means that actually for the work, going to work become an issue. Because they don't feel like they are going, but if they go there, they are tired. They don't know how to explain it to their superiors. So that can create a lot of problems for many, many people. And also, actually, we've just done some work. Actually, this work basically asking different people, especially those people with the long COVID. And it turns out that actually many people, when they do have it, they find it very difficult to even mention it to their own husbands and wives and others, because then people will feel that they are being lazy. So there's a whole lot of things around it, and also stigma attached to that. As you know, the COVID came in, and so many people, even if they do have the COVID, they don't want people to know that they have the COVID. So all of a sudden they end up being tired, and others, they don't want people to know that they are tired, because they feel that people are going to go, oh, they have a long COVID. So that is also a social aspect part to it. And then, more importantly, also for the family's interactions, because this come in, you are very tired, you basically just don't want to do anything. So if you don't take care, you get yourself isolated. So there's a whole lot of the social aspect part to it. And then also for the economic part, because if you are unable to go to work, and really, that means that actually, if you don't take care, you might even end up losing your job. And then you lose your income, right? So the long COVID part, I think, has a huge consequences, both for the social as well as economic impact. And that's why it's so important that what we are talking about, people need to know how to seek help. Because if you don't seek help and you continue to sit there and then suffer on your own, it's going to help you. And that's why I'm so pleased also that, you are discussing this. And more importantly, you also have the C support people here who have a lot of knowledge to see how people can actually, ask for help.
Great. C support. We are very happy to have you.
Welcome to be here.
Can you please tell us by your name and what you do?
I'm Janine from C Support, and I'm an aftercare consultant. And what we do is we talk to the people who are signed up for by C Support, and we try to listen to them, and especially what Charles said. We try to talk into the problems they have and to try to explain what they can do, basically. So that's basically what we do. But we do a lot more. But maybe we come later to that.
Okay. Thank you so much for being here.
My name is Miranda. I'm also an aftercare consultant, just like Janine. And I work at C-Support in Amsterdam here. C-Support, just a little bit of what C-Support is. We're a foundation commissioned by the Ministry of Health, Sports and Welfare. And we support patients with long COVID. We give advice. And we work together with other paramedic professionals. So we do training workshops to share the knowledge about long COVID. And till now, I think 28,000, almost 29,000 people been able to reach us. Okay. And we're really happy to be here to see.
Yeah.
Spread
Because
knowledge.
there are many more people with long COVID, so it's really important that people know that C-Support exists and where to find us and how they can reach us. Yeah.
How long does C-Support exist?
It started 2021.
Okay.
21, I guess. I'm not sure. I think, yeah. After the first COVID.
2020.
2020? No, it's 21.
Okay.
21. And that was the first period that there was a lot of people who suffered from COVID, and after that, after 3 months, that the disease came through. Let's say,
Because why haven't we heard about you for all this time? If professor called me that there's something, I would say, wow.
Yeah.
The community don't know about C-Support. People are depressed. People are being pressured by their bosses to go to work. They don't know what they have. And C-Support has been there all this time. Thank you, Prof, for bringing them today to the community so that we know there's help somewhere.
But that's the thing, I think, Veronica, that we didn't know how to reach all of the people. We tried, and hopefully now it's coming through certain communities. But we didn't know how to reach. That's the thing.
What we do is people have to sign up through our website, and then we will call them to make an appointment. All our conversations are by phone. And what we do is that we just ask them about health, income, work, social life, all the aspects in life that are important and that can be affected by the long COVID. And then we'll see, we'll just talk to them and advise them where can you go, what kind of complaints do you have, and with paramedic service or recovery care or the GP who can help you with certain complaints, which can be really diverse because it's in all life aspects.
You have to go through your GP?
No, you don't have to have a referral to go to C-Support. You can just sign yourself in.
You go to the website and you have all the information that you need, the telephone number and everything, how people can really
the website
reach
is in
you.
English.
It's
in English.
It's
and
English.
We have a
Okay.
flyer in the website that is in 11 languages. So.
Oh, okay.
And maybe it's good to say, Veronica, as well, at the moment you call us or you sign in, and after that they call you back to make an intake appointment, and after that the aftercare consultants will call you to make an appointment. So we take a lot of time for you and we listen to you, and after that we can, what we do is we give advice, we give information, and what the best thing to do is for you at that time. After we listened to you.
You have to pay to get the help from C-Support.
No.
You don't have to pay.
It's for free. Everything is for free.
Oh, okay.
See, now very important information is up there, right?
Yeah.
Because it's subsidized by the government.
Okay.
So That's for free.
Yeah.
Do you have a long waiting list before people can come?
So,
Yeah, it fluctuates.
yeah, approximately about 2 weeks.
Okay, that's very
Approximately.
Okay.
Based on the busyness of the sign-ups and the people who wants to call us, but approximately 2 weeks.
Okay. Can
So
you
from the start, you signed in or you made an appointment, then you have to wait approximately 2 weeks before we call you.
Okay. And do you get people from our community
Yeah.
that come to you already?
That's what I don't know exactly because I'm not sure if we have a lot of people from your community. There are English spoken people as well, but I'm not sure if they're from your community. Maybe
I
not.
haven't heard yet.
No, I
Not
don't. I'm not
yet.
sure.
Well, viewers, we've talked about long COVID, the seriousness about this. We don't know much about it. Today, the doctors have explained a lot. And now we have support, and they are telling us there is support. If you have long COVID, you can't go to work, you are being pressured, and you are depressed. Just call support. The website and the telephone number is on the screen. Call them and register, and they are there to help you. Do you have any take-home message for my community?
If you feel miserable after you're infected, after your COVID infection, don't be afraid. Just call us. They will help you immediately, and don't be afraid for whatsoever. We will listen to you.
Oh, great.
Ultimately.
Before we run up, can you give me some examples of some of the cases that you've handled?
Yeah, for example, what we can do if what you were telling Veronica, that the boss is really pressuring, what we can do is talk to the boss, explain to the company doctor that what long COVID is. There are certain things they can follow for reintegration with long COVID. That's different than the normal reintegration process. So we do have a lot of information we can share with the work, with the company doctor.
Okay.
For example, yeah.
Yeah, that's great, because then they will know that this is a problem.
Yeah.
And the person needs time to heal. So you come to support this person to get the help that is needed. Prof, there has been lots of deaths in the community these days. Sudden deaths. The community is panicking. And we don't know the cause.
First of all, I think that it depends upon how you define the sudden death, right?
Yeah.
Of course, the sudden death could be young, could be, but I think it's that, I remember that you have a similar situation and then you went back to look at the data and you saw that actually there wasn't much. So I think that you shouldn't panic too much. You need to figure it out what is actually happening in the community. But before you be able to actually answer this, you need to basically go back and just look at the data, what is actually happening in there. Yes. But of course, it is difficult, but I think, I don't know whether this has to do with COVID, but it's not certain that you can say it's COVID, right?
Yeah.
So you need to be upfront. So it might be other, causes that it is, but it is really, really difficult. But what I would say is that if people are ill, and because now we know that so many people, when they are ill, they basically don't seek, care in time. They just dragged out, and then, the condition becomes, once the condition becomes too severe before they go to the hospital.
Yeah, and maybe it's good to say they don't recognize the symptoms.
Exactly.
Maybe.
And
that's good to say because there are several symptoms, but the most important are the extremely tiredness, fatigue, headaches, pain in your joints, in your body, all malaise. So if that's
Concentration.
concentration problems, memory problems,
Just what Brent said earlier on.
Exactly.
word finding problems. So if that's those things you're suffering from, please call us.
And I think it's also very, very important. Many people sometimes think that, oh, I'm going to go there, I have to go to pay for it, it's too expensive, I don't have the money. But this is completely free.
Yeah, it is.
Right? All what you need is just basically picking up the phone or call or just, basically subscribe through the website. It's very, very simple. So you don't have to wait. And what I would advise is that, you are in the Netherlands. Netherlands is one of the top healthcare services in the world, right? So there's a support there. So you just have to try and use it. And if you don't understand it, ask someone else who understands it, so that you can make use of it. And so that you don't wait too much time and get your situation worse before you seek help. Because the earlier you actually go, the better you'll be able to be supported, right? Absolutely. So it's very, very important
and
that the community here. Yeah, exactly. So it's very, very important that the community look at this and just make use of the services that is available in the country.
Great. We are so happy to know that you really exist and we can come to you.
Please call
for help.
Even if you hesitate, just call to ask, is this long COVID? What can I do? Yeah.
And there are people who talk English, maybe not as good as you, but they're trying. So don't hesitate.
Okay. And you are in Amsterdam.
Yes. I mean.
Well, there's so much help out there. Don't wait until it's too late. What's your last message, Prof?
I think I would say that, I'm very, very pleased today because now you have managed to bring the expert out, those people that are working on it from research perspective. You also have those people that are actually basically making sure that people that needs help do receive it. And we've spoken to all these people. So there is no reason why you should wait now. So what I would say is that please, if you are experiencing symptoms of COVID, just pick up the phone and call and seek for help. Because the earlier you seek for help, the better for you and for the society as a whole. And more importantly, also, thank you very much for basically inviting us to discuss this very, very important topic. So thank you very much. We really appreciate that.
And thank you also.
Thank you.
For always being there for us. Yeah. What's your last advice for my viewers?
Just call us. There is no cure, but we can help you, support you with the post-COVID.
Okay.
And the advice. So we know what we do.
Yeah.
So don't hesitate. Call.
We know what we do. See support, know what they do. So please, just call and they'll be there for you. Thank you very much for watching. I'm Veronica from the Kamp, your host. See you next time.